Thank you, Bernard, for the introduction. The year is 1854. The place is Soho district of London Greater Metropolitan Area in the United Kingdom. A cholera outbreak has been raging at that time, and many have been speculating. Is it a miasma-based infection, or it's basically a germ-based infection? But there is one person, one epidemiologist, his name is John Snow, wanted to use methods, techniques, science, maybe technology, we could call it technology at that time, primal, but technology nevertheless. And he took all of the cases and he plotted them on a map, what we call now spatial data. And he found a pattern that most of the cases, they are concentrated on a spot in Soho. And in that spot, at the middle of the spot, there is a street water pump. At that time, people were getting their water from the street water pumps. So he had a hypothesis based on this finding that it's a germ-based, waterborne infection. But he wanted to prove the hypothesis, so he shut down the water pump and the outbreak was gone. I just wanted to start with this story just to highlight that modern epidemiology, in its inception, it was intertwined with technology. What we see from the map of John Snow from 1854 resembles what we use now when it comes to GIS. Many actually think that it is the precursor of GIS. Of course, we have come along the way since 1854, and we have invented a lot of technologies, and some of them are emerging technologies, and Gartner has done a beautiful job laying all of those emerging technologies in their publication that they released last month, all of the emerging technologies of 2020. What's interesting is two of the top priority technologies, emerging technologies, transformational and high priority, and in the short term, within 2 years from now, they are related to epidemiology surveillance. We're talking about health passports and social distancing, which we're going to talk about in a little bit of detail later. One of the papers that was published also recently by Ting and his colleagues, looking into the underlying emerging technologies of these two at least, and other epidemiology emerging technologies, and ranking them. So they found that the top are 4 emerging basic technologies. So Internet of Things, IoT, and big data, these are the 2 top. Of course, you want to gather as much as possible data from the field, from cameras, from sensors, from wearable devices, and you do this using IoT. And you're going to get a lot of data out of this, and all types of data, structured, unstructured, and semi-structured data. And where do you store this? You can't store this in a conventional platform or conventional database. You got to have a big data solution. And then what are you going to do with the data? You have to harness the data. So use artificial intelligence. So it comes second. And in some cases, if you have data that has multiple custodians, such as insurance data, some pharmaceutical data where you have the insurance company, you have the pharmaceutical company and the healthcare provider, they all share the ledger, sort of say. You might want to use a blockchain. But all of those technologies, they are the means. They are the vehicle that take you to the goal. They're not the goal. ICT, information and communication technology, they're never the goal. They're the means to take you to your objectives. And in this case, we're talking about epidemiology surveillance. So if we look into the surveillance and its types based on the WHO categorization, so you have national active, which basically is the action of you pursuing and trying to solicit the information and the cases. And there is passive, where you receive the information in a passive way, all kind of epidemiology information, and then you crunch the data and analyze it on the background. And there is Sentinel, where you specify multiple entities to capture the high quality data, and then you rely on the data for further decisions. So out of these three goals of surveillance, we have variety of technologies under our disposal. One of them, which is currently the most mature relatively as an emerging technology, is the social distancing technology. I mean, it's a national active kind of technology. It enables the encouragement for individuals to maintain safe distances, whether it's 6 feet or 2 meters, depends on the unit that is used. And it could also be used for contact tracing, which we're going to see later. When it comes to contact tracing, one of the recent papers was published by Raed and her colleagues a couple of months ago, actually. They did actually highlight how it could be done and how it could be done with an instant contact kind of model. So at the top left here, if we have person A lives with person B in a home, and then person A want to go to work, this person is riding the train and gets in contact with 2 people, goes to work, gets in contact with 3 people, and maybe nearby, not really closer than 6 feet or 2 meters, and then goes back home. Next day, person A is symptomatic and tested COVID-19 positive. If you have an instant contact tracing solution, it has to be the whole environment. It has to cover all of the entities that are involved. So if you have this instant contact tracing solution, the solution automatically is going to notify all of the people that person A was in contact with to self-isolate and maybe order COVID-19 tests for them. Also the people that were just nearby, that were not closer than 6 feet or 2 meters, maybe notify them, maybe order even COVID-19 tests for them. What they have done in the study, the researchers here, is also they created a simulation model based on mathematical algorithms to compare between having an instant contact tracing versus 1-day latency versus 2-day and 3-day latencies. And we see at the bottom a heat map graph. From the far right, you would see that the success of isolation and quarantining is obviously having a significant rate. And if we go left step by step, you see the success disappearing all the way until 3 days, which is almost non-existent. So it was very interesting kind of finding that they come up with based on this simulation modeling. There are single-use kind of solutions that workplaces could use, hospitals, factories, et cetera, et cetera. There are social distancing and contact tracing solutions that use commonly used platforms such as smartwatches and other platforms. They have advantages over the single use. You could get better kind of communication and messaging out of them, and also capture more information. There are solutions that don't require wearable devices. One of them was developed by Amazon. They have implemented this in a couple of their warehouses, and it just uses a camera with a depth sensor, and it actually monitors the workspace based on the field of view. And we could see on the right side, 3 of their employees, they're not closer than 6 feet. And once they have, one of them came closer than 6 feet, the circle would become red for the person that came closer. The other people will get an orange circle, and then you get an alarm. The solution has been open sourced by Amazon, so you could implement it free of charge. You could have access to the source code, and you could also add contact tracing capability on top of it. There are thermal cameras that also could control access to places and do passive surveillance as well. And there is also the health passport, which is an emerging technology in its embryonic stage. It is a national active, no doubt about this, and it controls access to public and private places based on information that it gets from travel, from health records of the people, et cetera, et cetera. Then it assigns either a health index for the person or maybe the status of the person health-wise. It has been implemented in a couple of places so far that I came and I read about, and one of the largest one is in China. They did implement a solution, they called it Health Code, launched it a few months ago in all of the 23 provinces of China. And the system controls the access to many workplaces, public and private places. It flags each and every person, whether green, yellow, red, and if you are red or yellow, you just can't access the place. On the right side, we see few people lining up, scanning the QR barcode on the table, and then getting the status. So if some of them is red, one of them is red or yellow, they're not getting in, and the data is logged that they were there, other people were among them, and they might quarantine as well. There is India's experience, which is way less scope kind of implementation. Is just limited to rail and air travel. To alleviate the privacy concern, they have open source solutions. So you know what they're doing with the data and what kind of data they're capturing, et cetera, et cetera. But there are also issues other than privacy, which is the proliferation of smartphones. Obviously, based on at least one study, there is no more than 35% of the cell phones in India that are smart, others are just conventional phones. So what if you don't have a smartphone and you want to ride a train or you want to fly? Are you going to be prevented? It's a big question. Another very promising technology is it's basically based on big data. It's data lakes where you capture all kind of data with all types of data, and then you crunch the data and predict pandemics and also identify the status of the maybe ongoing pandemic situation. Could be implemented at a global, national, or local level. There are a couple of programs I have to highlight, actually. They have the germ of the idea of data lakes, but they don't have the technology itself. So one of them was implemented way in the 1990s, and it was basically a collaboration between Canada's Public Health Agency and the WHO. Although it was implemented a long time ago, it's still within the Canada kind of territory implementation. There is also the ProMed Mail, where they have teams in 23 countries. They capture information and then the information gets published. And there are also aggregators. They aggregate data from ProMed Mail and other sources, even news sources, and then indicate epidemic issues. There is another technology that is on the horizon, but again, it's in a very early stage of development. It's the digital twin of the person, DTOM. And this technology is all about creating a complete digital replica of each and every person in the population. Information that covers almost everything from demographics, health, genetic, financial. Again, it's a very early stage. It will take at least 5 to 10 years based on some of the experts' opinions, and it has a large privacy concern, no doubt about this. Again, according to the hype cycle of Gartner, it's in an early stage, and it could actually allow entities to make real-time decisions, simulate in a safe way, because you're really working on a digital kind of component of the population, which replicates the real population. So something to keep eye on. There is small data versus big data. The problem with pandemics is basically when they are first emerging, they're not providing a lot of data. And with AI, artificial intelligence, they require a lot of data. So what are you going to do now? You're going to wait until you accumulate a lot of data. It's going to be too late. So small data is going to take care of this. But again, it's an early stage, something to keep eye on. All of those technologies have common challenges. There's cost challenge, cost to develop, cost to implement, and cost to maintain. There is IT infrastructure at a global and national and local level. You need high connectivity, high coverage, and high-speed connectivity, reliable connectivity as well, and you need back-end resources to support implementing all of those technologies. And there is privacy issues, probably on all of the technologies that we covered. A privacy issue that exists now, maybe in the future, or maybe not actually. So one of the studies by the University of Southern California, recent study, has shown that the concern about data privacy across generations. Let's look at the bottom row here. They're very concerned about data privacy. Baby boomers, and that was limited to the US. So baby boomers, they were, almost half of them were concerned, 47% of them were concerned, very concerned about data privacy. But look at Gen Z, the generation that share everything on social media. They're 28% concerned. So are we going to see less and less concern about data privacy along the way? So maybe the technologies that we talked about, the emerging technologies that have big privacy concerns will be just viable, maybe. But now we're living in the current time and we have to deal with privacy. So implement as much as possible layers of privacy protection, data security that would add more layers, non-discrimination, a layer to protect certain minorities, and also transparency. So Dr. Balkhi mentioned transparency as a key player to get the buy-in from the public. So people have to know what kind of data you're capturing, what are you doing with the data, et cetera, et cetera. And also in some applications, maybe you don't need to capture identities. Maybe you just capture findings from the edge site. At a global level, we really have to have a strategy for digital epidemiology surveillance, a strategy and a roadmap, similar to what Gartner has done with the emerging technologies matrix on the right side, something that tackles short-term, mid-term, and long-term, and all kind of priority levels. Also, we need to tackle the digital maturity at a global, national, and healthcare systems across the globe, data interoperability, integration, data sharing. Maybe some of the programs that we just covered, ProMed, Mail, and other programs, their issue not detecting, and we saw the survey that we just had. A lot of people, almost 50% of the people that responded, they did not believe that predictions of COVID-19 were successful, as far as I understood. So probably having a data sharing would make programs that are already implemented more successful. And also, if we implement programs that are based on emerging technologies, we're going to get better success. Investment in emerging technologies that we talked about and more for early warning systems, and also accurate predictions, real-time predictions. We have to really change our ways of doing things. The virus mutates itself all the time and changes its tactics. Ourselves as humans, we have to do the same things, obviously. Thank you so much for listening. I hope that you found this speech informative. Thank you so much.